This is Dr. Lillian Schapiro, and I am here to talk to you today about a colposcopy. A colposcopy is the next step in diagnosis when you have an abnormal pap smear. So what are you coming back for when you're coming back for a colposcopy? This is a picture of a colposcope. So this is the part that's looking at you. Looks a little bit like a robot, but really it's just a fancy microscope. And then this is the part that I look through. This is the uterus right here, and inside here you can see in the cervix. So the speculum goes inside of the vagina, just like in a regular pap smear, and you can see in there that we are looking right at the cervix. We put vinegar on your cervix. Sounds kind of crazy, but the vinegar reacts with the carbohydrates in the cell and makes it possible for us to see which cells are absorbing more and are therefore somewhat abnormal. So we put vinegar on the cervix with this thick cotton tip swab, and we dip this into the vinegar through the speculum and onto your cervix. Shine a green light on it, and that makes us be able to see the abnormal cells. We will then take a biopsy. So the uterus, fortunately, only knows how to feel one thing: a cramp. Basically, we are taking a little piece of the cervix or a few pieces. This is one of the different types of biopsy forceps that are used. Fortunately, the uterus only knows how to feel a cramp, so that is all you feel with this. Abnormal cells start here at the end of the cervix, which is where it's exposed to the HPV virus, but then abnormal cells can also grow up this way on what is called the endocervix. To reach up into the endocervix, we use something called an endocervical cure. When we use this, we go back and forth in the endocervix, and that is often the most severe cramping of the entire procedure. Well, after that, there is often some bleeding. And to stop that bleeding, we use a solution called Moncels. So you can have this discharge. It ends up actually looking a lot like coffee grounds. The initial Moncels looks like peanut butter, and then it moves to coffee grounds. And this discharge can go on for a week or two. The restrictions after a colposcopy are basically of no impact. So no running and no sex. We don't want anything to knock off the clots. We want you to stay healthy, though. You can go for a walk, you can go for a bicycle ride. So the colposcopy is to diagnose just how abnormal your cells are. Your colposcopy may actually come back showing that your cervical cells are normal, or it may come back showing that your cervical cells have atypia. In that case, we generally just repeat the pap smear in 1 year. You may come back showing dysplasia, or what's also called CIN, cervical intraepithelial neoplasia, which are progressive abnormalities of the cell. Abnormal cells are an entire lecture. This is just an overview of what they look like under the microscope. And your doctor will talk to you about what the different treatments are for those abnormalities. The treatment generally for moderate and severe dysplasia is a LEAP. And I will, of course, be posting a video on that shortly. Please hit the subscribe button. And if you have questions and want to talk to one of us in person, please give us a call at 470-312-3696.